So, why do children who are on the spectrum show so much of seeking behavior? They're struggling with sensory issues. And is therapy the only answer for this? Well, if we really understand what's really going on in the child's brain, what is going on in the gut, how the immune system is, if the immune system is dysregulated in the body, we can actually get a lot of meaningful answers which can help in better sensory processing. So today's workshop is all about understanding what's really driving these sensory issues in children on the spectrum. What we will also cover is differentiating between autism actually, real autism, and autism mimicking behavior. So we'll cover all of that. And with that, myself, I'm Dr. Ruhi, co-founder of Functional Medicine Clinic, and I have with me Dr. Ashwani Garg, also co-founder of Functional Medicine Clinic. For the next 1 hour, I request all of you to please focus on the workshop so that you can make the most out of this. You can have some takeaways for you to understand what you can do better for your child. Towards the end, we will have a Q&A session where you'll be allowed to unmute and ask your questions. You can also leave your questions in the chat. We will take all of them later. So, okay, over to you, Dr. Ashwin.
Thank you so much, Dr. Ruhi, and good evening to everyone. Now, just like Dr. Ruhi said, it's a complicated topic today what we will discuss. So I'll try to make it as simple as it is possible. But kindly don't be doing multiple things while you are on this webinar, okay? So that you can make the most out of it. Because right information is important so that we can solve the problem. Else it's the problem itself becomes very tough. So now just set the background. Okay. Across the world, most of the treatment for ASD, autism, GDD, let's say we try to do behavioral modifications. We try to do some speech therapy. We are putting in some supplements and probably using some drugs. We want to modulate some of the neurotransmitters. But at the end of the day, we don't know why the certain behavior is there. We don't know why the speech delay is there. We don't know what all is happening in the body, which needs a fixing. Now, typically, when we work with autism, we look at the whole lot, and slowly, gradually, it's all is there in the literature, but you really need to figure out the answers. So, actually, at the biology level of autism ASD, the immune dysregulation is there, which means immune is more dysregulated, and autoimmunity kind of thing is building in the body. They have a chronic inflammation, which is in the gut, which is in the body, which is also in the brain. Nowadays, everybody is hearing about this folate receptor antibodies. This is a part of the immune regulation. This is one kind of autoantibody, folate receptor, but there could be other antibodies also. There are other antibodies also. Then, because of this whole inflammation, this microglial activation pattern, this excess activation of the microglia, thereby there's more damage happening in the brain. Then there's a mitochondrial deficit. It's a mitochondrial dysfunction. Because of that, then hypotonia, language is poor, memory is poor, things like that. Then there is a abnormal psychedelic effect in the body because of the infection serotonin, excess serotonin. Then eventually bodies start using tryptophan to convert into tryptamine, and thereby one of the key pathology which is leading to the sensory overload, which we'll discuss, but this is the key point. It's an abnormal serotonin tryptamine metabolism, and which is leading to more thalamocortical circuit overload. And because of this inflammation, there's also poor synaptic pruning, sometimes excess damage, sometimes less of pruning, whatever it may be. Eventually, this overall biology problem. Okay, brain health gets compromised. But we are primarily focused on fixing from outside. But internally, so much is happening in the body. And until we fix that, what is happening in the body, which is also a tricky, long drawn process. But if we don't fix it, outside things may not be able to resolve a lot of these things. And as a parent, we struggle all the time, right? So, behavioral therapy may help with some coping strategies and adaptive skills, but it will not fix the underlying neurobiological dysfunction or inflammation. Okay. Speech therapy may help with some level of development of communication pathways, but cannot repair damaged neural circuits or metabolic blockades, which are there because of that speech delay is there. Now, diet and nutrition is important, absolutely important, but then it may not be alone enough to fix the autoimmunity in the body, for example, metabolic dysfunction, for example. We can use certain drugs to temporarily control the hyperactivity, sensory load. Risperidone is one of the commonly used drugs, which is okay, nothing wrong, but then it doesn't again solve the long-term problem. There's excitation happening. We put in a drug, we block the receptor for a short period of time, and child calms down. But why do we have the problem in the first place? For long-term strategy, we need to solve the problem also. Then again, we may bring in psychological interventions. But again, underlying brain inflammation, metabolic blocks are. We need to do a thorough work. You just cannot do one part of the thing and thinking it may solve. It's not happening. Now, very, very important for everybody. I think I have been thinking on this lines, but it's always difficult to float a new theory and proposition. But if you really, as a parent, I want you to think about, don't worry about the science itself. Of course, there are few doctors in the world which are believing 30 to 60% of the autistic diagnosed children or ASD diagnosed children are actually not the real autism which is there, but it is something which is mimicking like autism. Okay. Now everybody who reads the books, and the books are defining the autism which was there maybe 60, 80 years back, and they say it cannot be fixed. But the problem today, which is growing rampantly, increasing, may not be the true autism. It is something which is mimicking like autism. How do we differentiate? Let's say you start some treatment, you start some homeopathy, you start some Ayurveda, you start some functional medicine, or maybe allopathy also, and we see some improvement. That it it gives us a clue that it's a treatable mimicking autism, not a true autism. Let's say your child is having a speech problem or very aggression. You do some antifungal, antiparasitic treatment, and temporarily child feels better. Aggression is less, and some speech is coming. That means it was not because the only autism. It is maybe a problem in the body which is mimicking like autism, but there's a thing which we can fix, which indicates that some infectious inflammation etiology is there. Okay. Sometimes all the time we see today child is not so bad, and full moon comes, it becomes bad. Then it is again little better, then again bad, little better. Fever comes, it becomes worse. After fever, you do some treatment, it gets, it's keep fluctuating. Then it again points towards a metabolic dysfunction or inflammatory trigger in the body. It's not the true autism that, ASD, whatever. So it is seemingly to be similar, but this is the one that most of the children today suffer. Looks like it is a treatable problem. Okay. And a lot of the time, child was doing okay, year and a half, 1.8, things are okay, growth is okay. You have been going to your doctors, and there was no concern. And out of nowhere, either after vaccination or post infection or too much of a screen, there's a regression. Okay. So this may be some neuroinflammation triggered by the incident that has happened. Again, it is may not be a real thing. It is a mimicking autism. Then you give somebody risperidone or cyproheptadine. These are some of the blockers that reduces the sensory load onto the brain. Thereby, the child becomes more calmer. Then also it's a clue that it's not the true thing. Okay. Similarly, you do antiparasitics, you do antifungals, you do antihistamines. Child feels better. Something is more than autism. It's more like a medical problem which is treatable. Then, of course, you look at the nails. There's a deficiency. There's sweating at night. You do deworming, it gets better. That again means something dysregulated in the body. You fix that, child becomes better. It's not something permanent in the body. Okay, somebody starts probiotics, child feels better, right? It's something with the microbiome which is not okay, which needs a resolution. Just to bring a very context to this story, that uh, we need to differentiate with the right from the right problem and the right diagnosis. Otherwise, what happens? A label is given, and you're told nothing can happen. And most of the time, this is the story. Maybe this is not a problem. This is something. This is a very treatable medical problem, and we need to define the problem, and we work on that for long enough time, year and a half, 2 years, and then child can have a turnaround. Of course, some cases it takes longer, some cases it's shorter, but it is a treatable problem. Now, coming to the today's topic, which is the sensory overload. Okay. Now, different terms are used in the therapy world: sensory seeking, sensory overload, sensory processing. So much is happening, and somebody, even for me also, when a parent tells me my child has this problem, that problem, I really need to dig deeper and ask the parent what is really it is, what is a real symptom, and what is a trigger. But sometimes the big terms are used, but really when you dig deeper, nothing that you can grab on that you can fix about. Okay. But luckily, science is progressing. We have better answers today. Now, one of the reasons behind oversensory load is thalamocortical circuit overload. Basically, you have your brain, and below that, there's a part of the brain which is called thalamus, which is connected to cortexes. Now, the thalamus is working as a dampening mechanism. It is a lot of processes it does, but one of the thing is it will receive all the inputs from the sensory organs: touch, eyes, ears. It receives all the information, and it helps to dampen the irrelevant information and send the right information to the brain. In case of autism, because of the various problems, the thalamus has increased T type calcium channel firing. There's an increased excitation of the thalamus. Because of that, the dampening effect of the thalamus is not happening. Because of that, this overload of sensory input from the different sensory organs are being pumped into the brain, and bodies don't know what to do about it, how to fix it. Thereby, there's a profound sound sensitivity, there's auditory distortion, there's visual stimming, repetitive behavior, visual seeking, sensory meltdowns. There's so much information coming to your brain, you don't know what to do about it, and you are perplexed and you start crying. Okay, then attention becomes a problem, right? So it's like you don't know what is relevant, and you don't know what is irrelevant. It's so much of load of information which should have been blocked. Okay, the information should have been damped. It's not been damped, and all of that is coming to the cortex, thereby a big problem, right? So this dysfunction of thalamocortical region lead to It does the sensory filtering. For example, the right information will be enhanced and the unwanted information will be damped. But if this is not happening, all the dump is going to the brain, and the child is very, very perplexed, and there's so much of information he don't know, she don't know how to process it. Like, it's just simply, very, very simply put, it's like noise cancelling system is failing in the brain. So much information from different parts. At the same time, body don't understand which is relevant, which is irrelevant. All the information is, for example, if I'm in a school, I have to focus on the teacher, and there's a some wedding is going on outside the school. Now, if my brain and my system is okay, I can dampen that wedding loud noises, and I can focus on what the teacher is saying, and I can process what the teacher is saying. But if my mechanism to dampen that information, which is also coming from various other sources, of, for example, in this case, is wedding loud noises and the teacher, I cannot focus it. I cannot even interpret what is right and wrong. It's all is being dumped at the same time. So in autism, the thalamus fails to filter properly. Instead, overloading of the cortex, thereby lot of unprocessed sensory data. This is one of the key mechanism which is leading to the sensory. Okay. So this is also called as thalamic hyperexcitability in ASD. Right? So there is enough evidence in the literature today. And in fact, a lot of the drugs are also working on the similar receptors, which kind of blocks them, right? So thalamus normally suppresses this irrelevant output, enhances the signals which are relevant. Okay, so it reduces what is and enhances what is relevant. Like I said, I'm sitting in a class. My thalamus will help me enhance what the teacher is saying and dampen the noise which is coming from the wedding, which is outside the school. Right? But our children with ASD, they have this problem. They cannot switch on and off. Right? Thereby, sound sensitivity, thereby visual stimming, thereby sensory meltdowns, touch pain, distortion, attention fragmentation, sleep disturbance, all of that. Then these are some of the things that you always see. There's a firecracker and the child is crying. So much noise that's entering the cortex and child cannot handle that. Right. So I hope this gives you some bit of something that we can grab onto. Now, if I know the problem, then we can think about the solutioning around it. But sometimes a lot of these terms used in the regular therapy world, we don't know what it means. If how to interpret that information, and where do we put a focus to solve that problem? So this is to cortex. This is hyperconnectivity. And there are more connections because of more information is flowing, but doesn't mean all relevant. But this also means functionally very, very poor. Okay. So child who cannot transition between activities, who cannot fix onto one idea, because lot of the different information that is being hitting the cortex and it cannot focus upon. It's very, very simple. There are multiple receptors on different sides of the thalamus being active because of the various mechanisms, which will just looking at the receptors. For example, if T type calcium overactivation receptors activation is happening, then excess bursting of these receptors, thereby sensory overload. RTN hyperexcitability, poor filtering of incoming sensory data. Thalamus to cortex hyperconnectivity, overwhelmed cortex stimming will happen. If excess 5-HT2A signaling, psychedelic sensories, some of these children, they are in their own world, they're lost. And some of the time you will also understand that it's like there's high on some drug, that their eyes are lost. Okay, this is called psychedelic like sensory state. It's like somebody's high, and these molecules which are causing this psychedelic effect could be produced in the body itself. Somebody doesn't need to take it from outside. Another receptor which could be overactive, which is called excess sigma 1 activation, increased plasticity and chaos. Now, this overall activity, overstimulation of the senses is also happening because there is more toxins produced in the gut. Okay. I discussed about the serotonin is high. Because serotonin is high, body use tryptophan to convert into tryptamines, thereby more excitation into the thalamus, thereby more information going to the cortex. And another reason could be mitochondria is not okay, and there could be inflammation of the brain, right? So why do we have this hyperexcitability in the first place? Let's say now we know this is the problem. Now we need to know what could be the one of the major contributor to it, right? Dysbiosis, which means there are more infections and less healthy microbes, is one of the major contributor of making certain compounds. One of them is called DMT, tryptamine. They are the molecules which can cause more excitation. So a child with more infections will have more of these sensory issues. So dysbiosis is one of the major reasons. Infection will dysregulate the immune system, cause more inflammation. They can contribute to this hyperexcitability. Now, as compared to females, boys are more prone to this problem because genetically, one of the enzyme, which is called MAO, is not so efficiently working in boys. Because of that, there's more toxic metabolites which are produced, which is called tryptamine, DMT, bifenthrin, which is causing this excitability. Then, of course, heavy metals, mitochondrial dysfunction, infection of parasites, viral infections, poor microglial pruning. And of course, if mother at the time of pregnancy, she had an autoimmune problem, this can also becomes one of the genetic reason behind it. Because she had a problem, then it is being transmitted to the child. Okay. Now you know sensory issues, why it is happening, what is a sort of mechanism behind it. Then what are the reasons which is causing it. Now, typically, when it comes to medical management of it, first layer of thing is we want to clean the body, we want to clean the toxins, we want to reduce inflammation, and we want to reduce the dysbiotic flora in the body. We want to clean the infections, grow the good ones. Okay. But sometimes it's not enough. We are doing what we are doing, but the child still has a lot of these issues. Then second layer of things we can add increase things to increase GABA. For example, in clinically, we do something called passiflora. Now, passiflora can increase GABA in the body. Now, as there's more excitation, you can inhibit that by increasing the GABA. If there's more excitation, you can do a little more aggressive inhibition by increasing the GABA, or you can bring in the GABA supplement also. If that also doesn't help, then you can do pharmacology therapy, where you can do you can do similar drugs temporarily. Not that this comes as a permanent answer, because permanent answers lies in the dysbiosis. You need to correct that, but temporarily we can bring pharmacology therapy to block those receptors, so that at least till there are toxins, you can block the receptors so that more excitation is not happening. And meanwhile, you clean the body, reduce inflammation, and support the enzyme, support the mitochondria, things like that. So hope this presentation gives you more something that you can grab, and then something where we can work upon. It's a tough thing, but if we do the right things for good enough time, it is important. Sometimes this infection doesn't go in 3 months, 6 months. It can take much longer time. And these infections are like that. You stop working on it, they can regrow. It's like you've done it for 3 months and some level of recovery is made 20% recovery is made, and you say, okay, it's enough, I want to take a break. This can regrow, and same, you can go to the square one. These are tough infections, but yes. So at least the science is clear, at least if we are able to follow it.
Yes, yeah. So, all right, we'll open for questions. Anyone who has questions, you please raise your hands and then we will allow turns. Okay. Yes. Haridarshan, go ahead.
Uh, Hi, thanks for this session. I have a quick question for you. So, as you have explained everything about why this sensory issues happen, my question is regarding the two-way communication. So, I have a 6-year-old daughter. She's being diagnosed as a mild autism, and she can talk. She talks need basis, and she's quite good in studies as well. But the two-way communication is missing. I mean, she doesn't initiate the communication. She gives answer to the question that we ask her, but her willingness is missing, and also even if she tries to speak, she the word doesn't come out as smoothly as they should. So my question to you is, what is the cause of this, and how can we get any help from your side if we want to know more about it?
Well, Haridarshan, mitochondrial dysfunctions could be one of the reasons where, right? There's not enough energy for the body to make, communication to somebody. That's one. Second is maybe some part of the brain is not healthy enough to do that job. See, it's like any child will not have a complete failure of the brain. Some parts are okay, some parts relatively not so great. There's inflammation, there is metabolic dysfunction. So from our perspective, we always start with the basics. We look at the diet, lifestyle, nutrition, toxins, infections, inflammation, all of that. And beyond this, we start into regenerative medicine. In the regenerative medicine, we can do some peptides, we can do some stem cells to reduce the inflammation, which will further down, decrease the damage and body's own ability to repair. Plus, the peptides can also signal the body for more repair wherever the parts of the brain which are not great enough working. These regenerative therapies can stimulate the brain for its own repair, thereby a lot of goodness can come.
Okay, thank you. Thanks.
Yes, Nagarajan.
Oh, sir. Hello, good evening, doctor. I am Nagarajan from Kuwait, doctor.
Hi, sir.
Yeah. We were following this FMC, this thing for Shanvika for the last 2 years.
Yeah.
We have seen some improvements, of course, but not age appropriate. Still, a lot of this thing is behavioral issues and communication, expressive communication delays are still there. So, last we did was all the peptides, inflammation, all this, whatever the basic things, everything is done now. So still we are facing the same issue. I mean, she is not yet properly expressing her speech properly, and behavioral issues are still there. So it is affecting
Well,
her
sir, I think,
overall, the studies as
well,
well
I
as
think,
the other
no,
activities.
fair point, sir. So maybe next step we can, if you're in India sometime, we can do some stem cells also.
Some cell, okay.
Mm.
That is the only way out, or is there any other way?
Well, like I said, it's a layer by process. We start with the basics. Some kids, even with the basics, they start getting better. Some we have to do the best of the best, even for a few times. So this
Hmm.
is so far our experience. If basics are not helping cutting through, then probably we have to
Hmm.
move to next phase.
So even we did the exosome, doctor. Means the Malaysian
Fair point,
doctor
sir.
has
So
suggested.
exosomes are excrete of, yes, exosomes are excrete of the stem cell, which is growth factors, which are relatively very, very important. But again,
Mhm.
maybe one round is not enough. Maybe we have to do it multiple times, or we also has to fix the. So one of the things that we do stem cells is not only helping the brain, but also helping the immune system, which is dysregulated. Because of that, there's an inflammation. Because of that, there's a problem on the brain itself in the first place. So stem cells, IV will help regulate the immune system also, along with helping the brain health.
Mhm. Okay, fine, doctor. Thank you.
Okay, we'll take a question from the chat also. So Subhatra is asking, same thing Ayurvedic doctors explained. They gave some medicines for the sensory issue to improve the gut health and reduce sensory? Will it work as same?
Well, technically, how much it work, I don't know because I haven't used those herbs and drugs. But fundamental, the same.
Yeah. So, Subhatra, also to add to that, if they're giving a reason of gut health as one of the possible factors for the sensory issues and they're working to address that, yes, it should
ऑनलाइन
work
बात कर
in
रहा है
that case.
ठीक है इसमें जुगल है वो
Please,
दो
please
हजार आते हैं
mute yourself, those who are not asking the question. Okay. There's another question. Can you please explain what are peptides and what will it help with?
Okay. Well, our body is constantly repairing and regenerating, and this is a mechanism happening constantly in the body through the generation of signals by each organ, and these signals are being done by the peptide. So, for example, my liver is producing liver peptides to signal my body to do a repair work on the peptide, a liver. Thyroid is making its own peptides, brain is making its own peptides, things like that. So it's a inbuilt system in our body which is helping to keep ourselves more healthy and repairing our own organ system because we're constantly metabolizing. We old cells will go, new cells will come. Now, for some reason, let's say we are aging, we are not able to make enough peptide, or there's a disease in the body because of that we are not able to make enough peptides. Then we can do organ specific peptide to support each organ. For example, there are different brain peptides which can help signal the brain for its own repair. We can take immune peptides which can help signal the immune system, regulate the immune system. We can take pancreatic peptides, we can take liver peptides, we can take kidney peptides. So this is a system which is already inbuilt, but in this case, when we do a therapy, we take a similar peptide, biosimilar from outside, give it to the body to signal the organ system repair.
Yes, and just adding one more thing. So peptides are like the signaling molecules and which will go and signal the right cells where we want to stimulate. And as a process, what we also do is after signaling them, we then give them the repair molecule, which is actually the stem cells and like exosomes. Okay. Shrujana, you can unmute and ask your question.
Sir, like stem cell things are very costly, right? So if people can't afford that, what would be the alternative?
Well, ma'am, I think clinic to clinic, the cost may vary, but what we do is at a very, very affordable cost. You can ask independently of the, I don't want to mention any costing here, but our cost is fairly um, affordable as compared to what is in the market. You can ask the team. But yes, if still that is expensive, then I think, like I said, we start with the basics, then the nutrition, infections, toxins, all of that. Beyond that, regenerative medicine, peptides and stem cells. So then if the still if it is expensive for you, probably peptide something. Again, like every therapy has its own role to play and its potency. Peptides cannot replace stem cells, but then peptides are also part of regenerative medicine. They are very potent, but may not be enough as stem cells. But again, it's also important for everybody to understand that whatever we're trying to do is it is making the child towards betterment. There's no absolutism that I have done this and every problem is sorted. Some children have a mild problem, less problem, and you do the basic stuff. You don't even need the regenerative medicine. A child may come out of the problem. But sometimes child has more problems, more deficit. You have to do it multiple times to bring them to a status where they're patient. So that is something to understand.
Yeah, and Shrujana, you will have to always start with the basics. So if you've not done the basics, the foundational work, then doing advanced things like peptides, regenerative medicine will not yield results what it should. So we always have to start with the basics. Okay, I have just launched the poll. So those parents who want our team to connect with you. So if you can answer the poll, that will help us, connect with the people who need help. Okay, I'll take another question from the chat. Sidra is asking, can you explain more about MAO, which is present in the boys?
Well, it's a monoamine oxidase. It's an enzyme which breaks down certain metabolites. Now, if let's say there is MAO is weak in boys, because of that, there's more tryptamine or more DMT because of the infections in the body is being produced. That will cause more hyperexcitability in the thalamus and thereby sensory load to the cortex. And these boys will have more psychedelic effect. They might be lost in their own world. Social connects are poor, things like that. So just because of genetics, it's not that just because this gene is not so active doesn't mean that the child should have a problem. Just because this gene is weak, not as good as others, because of that, when there's more infection, the metabolism of these infection metabolites is not so great, thereby more of these psychedelic effects are happening, thereby more sensory issues and things like that.
Okay. So for those who are unmuting and asking, I request you to please keep your questions short because there are others also in the queue who want to ask the questions. Priyanka, please unmute yourself and ask. Okay, Asim, you are there?
Hello.
Yes, Priyanka.
Yeah.
Dr. Priyanka.
Good evening, sir.
Good evening.
Thank you for the wonderful insights today. Actually, I was just just wanted to ask you two or three questions. First of all, like, will antimicrobial peptides such as LL37 or few others, can they can we replace them with antifungals like nystatin or other variants of antifungals or antibiotic treatments in terms of C. diff like metronidazole?
Well, I don't know about whether it can independently be enough. When I'm using them together. I'm
Yeah,
using
because
antimicrobials, whatever necessary.
hmm, hmm. So the herbal antimicrobial can be a can like we can use it, but this straight forward these antifungal drugs and all, they again create some fungal resistance first of all after like doing one cycle. Then another thing was that with all these antibiotics and this again we don't have such kind of immunity in our kids, and the microbiome is already disturbed, and again they'll create a dysbiosis. So to replenish it again, it will take a lot of time back. Though I am following the diet
Well, I
for
think
for my child for like past almost a year, but the differences are really less.
fair
So I was
point, Dr.
thinking,
Priyanka. Now, my question, I get the question. Let me answer. Try to answer this one, then you can ask the second question. Now,
hmm,
it's a matter of perspective. Every school of thought is saying something else. Now, you cannot increase the diversity in the microbiome until you clean the tougher species. If
hmm,
tougher species are more there, other healthy species, you cannot grow them.
hmm, hmm,
So modulation also means you clean the bad bugs. Until you clean that good ones, there's no space for them. Or there's, they cannot even overtake by themselves. So now when we do clinically, at least we have been working with kids and adults and thousands of we
hmm,
have
hmm,
done. You clean and you regrow, you clean and regrow, and you build the immune system.
hmm,
You support the immune system with nutrition if required peptides, then you state a microbiome in the body. It's not a problem. Second, resistance, like I said, there are various strategies to avoid resistance. You don't do one antimicrobial for years. You do it for 3, 6
yeah,
weeks, 4 weeks. Then you can bring in something else. Then you can bring in some uh, enzymes to break the biofilms, which is one of the protective way to build this resistance.
hmm,
So
hmm,
this is
hmm,
my way of doing it fair. A lot of people saying a lot of things, but at the end of the day, if the basics are not working, we do. Second, I haven't done only LL7 and I cannot say that it is enough. I'm doing both, which is when basics, even antimicrobials are not helping enough. Then I bring in thymosin alpha 1 and LL37 along with it, and I see some progress.
Okay. So, like after 2 cycles of this repetition, also, still we can see that infections are here. So now can we bring in the peptides along, or
Correct.
here again we need the antimicrobial, this antifungals or antibiotic treatments?
Well, I think parallel. You do parallel. I would say that's what I know as of now.
Okay. And apart from that, what are your view on FMT treatments like fecal microbiota transfer, exosomes, and SCT? Like how you will step ahead? If we have Clostridia
Well,
difficile, then there
one
can be a
important
possibility that FMT can work.
no, well, fecal transplant is a good treatment for Clostridia, but if
Hmm.
if immune system is not okay,
Hmm.
if immune system is still not okay, now
Hmm.
you have done the modulation to the microbiome by the FMT, which is great, but it can come back to the status quo again
Okay. Hmm.
if
Hmm.
its system is not okay because heavy metals are there, for example. Let's say heavy metals down regulating the immune system, you done FMT, some results will come, and child can go back to the same story.
Okay.
So it is important that before we do these aggressive, it's a good therapy, but it's a very intense. There's 60, 80 sessions of FMT are required for healthy stool to be installed. But before that, make sure that there's enough cleanup happen and immune system is good.
Hmm. Hmm. And is it really important to do chelation before SCT if the heavy metals are there?
What is SCT?
Stem cell therapy.
Well, like I said, my purpose of doing stem cell therapy is for the purpose of stabilizing the immune system. But if heavy metals are there, which is regulating again, then how many times I can regulate? First, which is a trigger point, has to be taken out. Then doing it makes some sense. Else, what happens is an expensive thing. We get some benefits, we go back.
Hmm. Hmm. Okay, sir. And what about like first SCT should be done or exosomes should be done? Like autologous SCT.
Usually, I'm doing parallel.
Okay.
Well,
Okay.
if only brain health is compromised, rest of the body is okay. Immune
Hmm.
system is okay, toxins are okay, nutrition is okay, only brain health and the inflammation is okay in the brain.
Hmm.
You only want to enhance the brain. Autologous is okay. You take it from the body, put it into the spine, job done.
Hmm. Hmm.
Right?
Hmm.
But if immune system is still compromised, immune system is still dysregulated, which can again do the damage, then whatever recovery may can again go back.
Okay. Okay. Thank you, sir. Thanks for the time.
I'm sorry, I didn't understand how do you take call on stem cell therapy and exosomes or when you do it together. I think I just lost you there. The signal was poor for me.
Vasudha will allow you to ask the question. We'll just go by
All
turn.
right. Okay.
Asim, are you there?
Yes, doctor. I'm the parent for Hamza and Moaz, and Hamza now I think he's better. He's not that much aggressive, though he has some episodes. But for Moaz, he keeps on coming back to constipation, and now your team also is cooperating. We also did this antibiotic course. Again, he come to this, and when he get this constipation episodes, he lost all his development. He regressed a lot. So we are not
Right.
getting anywhere from last 1.5 year or so, even though we did stem cell and everything with him. So what is the solution you
Correct,
can
sir.
suggest?
Well, sir, like I said, it's a complicated issue. Okay. One of the key problem that both of the boys has a heavy load of infections. Okay, and when infections are there, immune system is again compromised. Then it is becomes easy for the infections to keep growing, even though we are multiple times we're cleaning that. So one thing is we had
कट गया. Hello, doctor. I think we lost you.
to make sure gut is moving.
Yes, so doctor, I think there was some disturbance. We lost you. What you were saying, it was stuck. The screen was stuck.
We have to make sure the gut is moving. Constipation we
Internet का
have to
problem था.
avoid at any cost. If it comes back, we can use.
It's disconnecting. Hello, hello. Yes, doctor. I think it's
Summarize,
poor.
summarize what
Yes.
he's saying. So basically, he is just re-emphasizing that we have to make sure that the gut motility is there. Constipation does not happen, right? So we have to ensure that the child is not constipated. And for this, if you have to use laxatives or you have to use certain things for gut motility, please use that as and when needed.
Okay. Actually, the what we are using it, but for example, now we are using movicol. After giving 2-3 sachets, the child gets to diarrhea. Then we stop it. Then after 10-15 days, he again gets this issue of constipation.
Dose titration. Dose titration. If let's say X amount is too much, you reduce the amount.
Okay.
So
Okay, doctor.
use the
Okay.
amount which is keeping the stomach loose, but not giving watery diarrhea.
Okay.
As the
Okay.
toxins will keep coming out, less will cause excitation, thereby less sensory issues.
No, the problem is
Child
that
has a lot of
now
sensory issues.
as you know, we did endoscopy. They said he has H. pylori, so we gave him the antibiotics. So again, the
Yeah.
doctor is saying he has H. pylori. So I don't know this
No, sir.
how to treat
The
this H.
regular
pylori.
the no. Don't worry about H. pylori. The problem is when the endoscopy goes in, they only look for H. pylori. Even healthy people can have H. pylori. Okay.
Yes.
But we have to look at even more tougher infections. H.
Okay.
pylori is still a doable thing.
Okay. And also, we did the chelation. Now they are on the 3rd month of chelation. Everything we tried. The problem is that for Hamza, maybe he's intelligent. He's something, but for Moaz, he's his brain development is zero. After all this is why we are worried.
Fair, sir. So again, like I said, complicated. We're looking at all possibilities, and we will continue to look at it.
Okay. Okay. Thank you, doctor. Thank you very much.
I'll take some questions from the chat. Anushri is asking, what are the tests we need to know which part of the brain is affected?
Well, I think if you do PET scan, at least PET scan can say which part is hypometabolic and which part is more inflamed. MRIs are usually, they say no problem. Usually, so if at all, but then it can only say this part is metabolically okay, not okay, or there's more inflammation in the brain. So this is where, from a scanning point of view. Now we are trying to develop a test where we can look at DMT, we can look at this tryptamine, we can look at these specific microorganisms which are producing this toxic waste. But again, a lot of these things are more clinical. It's a very recent happening in the research. I mean, we have been practically working on these things, but then connecting the dots slowly, it is evolving in the research. So we don't have a scanning test to figure out where is the issue.
Yeah, we have the question on the most popular leucovorin. So leucovorin has come as approved treatment for autism. Can it help in speech progress?
Again, it's just one part of the puzzle. Okay. If somebody has a dysregulated immune system, because of the dysregulated immune system, there are multiple autoantibodies against the brain cells are formed. One of the autoantibody is called folate receptor antibody, which is blocking the folate receptors. Now, leucovorin is nothing but a high dose B9, and you flood the body and the brain with a lot of B9. Some of the B9 will go stick to the receptor. That's all it is. Okay. The rest of the problems that I discussed even in the presentation is still pending. Autoimmunity is still pending. A receptor folate antibody is still pending. It is okay to some extent, may help and support, but bottom line, which we discussed, is still pending a problem which needs fixing. Otherwise, we may not get anywhere.
Okay, Sandila is asking, my daughter has severe sensory issues and non-verbal. Severe autism, 9 years old, she has dysbiosis and she's very sensitive to supplements. What can we do to make her gut better?
Well, sensitive to supplement basically means, I mean, when you supplement something, immune system gets better, they start killing those infections. And then there's more toxic release by this die-off reactions, thereby more sensory issues. So in this case, we have to clean her body. We have to nourish her body. We have to make her immune system better, but we have to go at a speed which is very, very slow. Okay. But we still have to do the same things.
Yeah, so Sandila, in short, we go slow so that her gut is able to handle. And as we do that, we also take care of the die-off reactions. Okay, Banu Priya, please ask your question.
Yeah, hi, doctor. Good evening. So I have two questions. The first one is related to the sensory issue. So when my son, when there is a mood swing, right, he gets very aggressive. He bangs his head on wall. So is this related to sensory issue or is something got to do with the gut?
So these are all connected. Sensory issues are happening because there's more hyperconnectivity of thalamus to the cortex. That is happening because receptors are more active. That activation of receptors is happening because there's more toxins being produced from the gut. Okay. So
Okay.
when there is already more excitation in the body becomes even overwhelmed with more of the sensory load, thereby head banging. And one of the reason of this specific head banging is parasites making these metabolites, which is causing more excitation to the brain.
Okay. How do we, what is the treatment for this head banging? Or how do we stop him from doing it, doctor?
You understand, it's not that we can fix this part or that part. At the end of
Okay.
the day, we have to fix the diet, lifestyle, test her child's infections, clean those infections. If immune system is compromised, fix that, and then see how the child is doing. If still not getting better, like I said, next layer we can do increased GABA for temporary support. If still not enough, we can do some receptor blockers like risperidone, certain other drugs, antihistamines, just to stabilize. But continuously cleanup is important. Infection cleanup is very, very important. Microbiome stabilization is very important. Immune system stabilization and autoimmunity correction is very, very important. It needs a whole lot of things, not just one part of it.
Yeah, thank you. So the next question is like, we did a whole exome test for my son, and we got to know that, there is a DNA duplication. So because of which, he has this autism and there are development delays. So I just want to understand that, there are a lot of newses about gene editing, and also will that actually be, will that work in future? So how effective will that be?
Well, I see something which is not happening, and I'm not privy to it. I haven't done it myself, so I cannot even comment on that.
Okay.
But you have to understand, just because one genetic modification is there or duplication, whatever it may be, doesn't mean every problem will happen to a child. So there is multiple things which could be wrong in the body, and this is one problem of genetics. right? Whenever that happens or whatever they may happen is fine. Future, we don't know. But rest of the things, at least we should maintain. We should fix that. What the best we can happen. Maybe it's not 100% that we can fix. Maybe we can fix it by 50%, 60%. And when that opportunity comes, when we have such a technology accessible, safe, we can try and see. I really don't know about it at this point of time.
Okay, thank you.
Okay, I'll take some questions from the chat. Okay, Vasudha, are you there? Okay.
Yeah, I'm there. Can you hear me?
Yeah, please ask
Yeah,
your
yeah.
Yeah, Dr. Ashwani was explaining to somebody when they asked about the cell therapy and the exosome therapy, and how would you take a call in between those two, and when do you do that in parallel? So I didn't understand his explanation because I lost him. So if you can kindly explain it again.
Well, in the case of autism, Vasudha, the brain is compromised, immune system is compromised. Because of that, gut microbiome is bad, and there's more excitation. Now we do the first layer of things and see if it is working, not working. If not working, we do additions to it. Okay, let's say first layer of things has improved the child to some extent, but still there are pending things. Then we can add more things to it, and one of the things is stem cells. Stem cells can regulate the immune system, autoimmunity correction, plus it will reduce the neuroinflammation, plus it will also help repair some parts of it. So more clinical, there's no objective way to decide when to do what to do, but more clinically we look at is basics are not working, we had to move to second layer. Second is body is ready for the second layer. If the toxins and heavy metals are still there, then no point putting in stem cells. This is how typically we look at it.
Okay, so in between stem cell therapy and the exosome therapy,
Oh, you want to say which one? Well, I think exosomes are excrete of the stem cells. Um, if less problem is there, my purpose is just anti-inflammatory processes we done to the body, then exosomes are enough. But if there's a lot of deficit in the brain that I have to cover, I can also put in stem cell alongside, which will help me regulate the immune system. And also in the body, they will anyway produce exosomes. So they keep producing for, let's say, 60, 90 days and keep the job on.
Got it. Okay. Got it. Thank you.
But to your you messaged me on the sensory overload. Hope you get some clarity. Infections causing excitation in the thalamus, causing a lot of information from the sound and lighting and visuals, all dumping into the cortex.
Right. Because we tried many of the things already.
Yeah.
So, right, I'll take it outside of this. No problem. Thank you.
Okay, I'll quickly cover some questions from the chat. Santosh is saying my son is very good in expressing himself, but when he tries to communicate with others, he gets excited and then he starts babbling.
Well, I think excitation will cause more sensory overload, thereby maybe loss of the rhythm. So we should look at the microbiome also in this case.
Right. Just give me a second. Okay. I think Manupri already asked her question. Okay, Barkat is saying he has a questions regarding the hair test and the treatment plan. Yes, Barkat, you can ask. What's your question if you're here? Okay. Frida,
Hello. Hi, Dr. Ashwani.
yes, please
Hello.
go.
Hi,
Yes,
Dr.
yes. Uh, we received the latest report for Muhammad Hassan, this hair test. I think so. You review. Aisha shared me the latest treatment plan. So I was concerned about what was the in the report deficiencies, lot of things. So it's pure technical. So can you please give me some uh, in
Sir, I
on
don't
that
have the
report?
report with me. Yes, I don't have the report with me, but if you look at the treatment plan, in the email, we would have sent a updated treatment plan with the interpretations of the report included in the treatment plan. So if you just read through the interpretations of the report, you will know what are the major problems and concerns out of the report and what are the actions to be done as of now based on the report.
Actually, because now the treatment plan you has revised, FMC has revised. So based on NutriFit hair test, it has been revised. But have you reviewed these both reports, because there are multiple things which are deficiencies for in NutriFit and this hair test.
That's what. Based on the report, we have reviewed and revised the plan, and whatever extra inputs to be done, they are included in the treatment plan already. But out of this, I think last week we had a session. Maybe coming week we will have a specific session for the parents who are already in the treatment plan, where you can write a mail to the team. I can bring in the plan and explain to you what it is. I don't have a plan with me
So,
now. That's
Mr.
the worst I
Barkat,
could have.
you already are in touch with your assigned doctor in the WhatsApp group, right? Where she has shared the revised plan. Everything has been
Yeah.
reviewed, and then the updated plan is sent. So if you have any questions, just ask in that WhatsApp group.
Yeah. So actually, just I wanted based this treatment plan is revised on based on these last updated report, because
Yes,
it's received on 18 November, na?
yes.
This by diagnostic
Yeah, yeah,
this.
yes, absolutely.
Yeah. Thank you.
Okay. So, Rudra, there's a question. My child has mild autism, good understanding, follows instructions, good sitting, good receptive language, but still has speech has not developed. He cannot speak clearly, he cannot articulate. So, Rudra, what's your question? Okay, I'll move on to another question. Sarika is saying my child is 5.6, non-verbal. Teeth grinding, laughing, all these are these sensory issues, and will speech therapy help?
Well, teeth grinding could be let's say a sensory issue because of the parasites. Hmm? Now, how will a therapy help with that? So that's in the first slide I have mentioned very clear categorically. These are medical problems in the body, and therapies cannot fix those problems. Please understand that very, very carefully. Otherwise, what happens is we end up losing a lot of time, and by the time child become 9 and 10, the disease will increase. Some patterns of the disease will become a part of personality and become so tough to fix it.
So teeth grinding is definitely a very clear sign of parasites. So speech therapy will not help alone. Okay, one last question, Frida. What is asking? What causes child to keep humming all the time?
Could be a sensory issue because more excitation to the cortex because sensory load.
Okay, Fatima is asking what should be done if the child has hypothalamus dysfunction.
Well, I think in the context of the hypothalamus being more connected or relaying more information to the cortex, first is the triggers which are causing this hyperexcitability. We discussed about that. We can fix that. Second is, if there's more excitation, we can bring in more GABA to bring in more inhibition. So that some level of sanity will prevail. Third layer of thing, like I said, you can bring in some pharmaceutical blockers to these receptors. One is the risperidone. But again, risperidone, short term, meanwhile you fix the problem, it's okay, but long term may not be a great answer.
We will take one last question. Gopal Krishna, you can unmute and ask.
Thank you. Hi, doctor. So my kid is 6 years old. Recently, we did some tests like organic acid test and then frat test, all those things. Organic acid test has yeast and candida, and frat has a little bit higher value of antibodies. So as frat is high, as per the recommendation, we started with the B vitamins, especially leucovorin and all those things. But I mean, even though it's improving little bit speech, but other things are hampering, maybe feeding issues. So do we need to take care of the candida and yeast first before even starting the B vitamins, or is there any correlations between those two?
Well, if folate receptor antibodies are positive, that means child has a autoimmunity.
I mean, it said high value, so can we assume that it's an autoantibody?
It's an autoantibody, which means child
Right.
has autoimmunity. Tested, there could be so many other antibodies which are affecting the brain.
Right.
Now, since autoimmunity is there, one of the reason of autoimmunity contribution is the infections, and in infections, yeast could be one of the infections which can contribute to the autoimmunity. So
Okay.
it's okay for B vitamins and leucovorin to be in place, but basically immune regulation and the things which are causing that immune dysregulation has to be fixed up. Very important. Else we lose the time.
Okay. So, doctor, whatever the gains we are seeing with leucovorin and everything, are those temporary in this case because other things are not resolved?
Well, it's like the receptor is blocked with the antibody. We are flooding the body with more leucovorin or B9 so that somebody will go stick to the receptor and some gain will happen.
Right.
But the baseline problem is as it is.
Okay.
We might have short-term gains. Just Trump and Junior Kennedy said something doesn't mean it is a treatment for autism. Autism is far more complex disorder.
Correct.
Okay, so with that, we will wrap up today's workshop. I hope all of you found it useful. Those who have not answered the poll, you can. And if you want our team to connect with you, Anwar has shared his WhatsApp number. You can connect with him. You can join our community to stay updated about our upcoming workshops. We'll do at least one workshop every month on a different topic to provide more insights to the parents. So I think we've taken a lot of questions. We're already running over time, so we will end here. So thank you all of you and have a great evening. Thank you.